Good morning. Now I would like to take a class on route of drug administration. Channels of the route of drug administration on enteral, parental and topical. So the enteral will be classified into oral, sublingual and buccal and rectal. So the oral route are referred as a method of administration applying topical on mouth, swallowing for absorption along the gastrointestinal tract into the systemic circulation. So what about the advantages of the oral? So the first one will be the convenient, can be self-medicated, pain-free, easy to take, absorption take place along the whole length of the GI tract. It will be cheaper compared to the other parental route. So what about the disadvantages of this method? So there will be some disadvantages. Some inefficient, only the part of the drug may be absorbed. Irritation of the gastric mucosa like nausea and vomiting. Destruction of the drug by the gastric acid and some of the digestive enzyme. The effect will be too slow whenever it's emergency, and sometimes will be the unable to use an unconscious patient. So what is meant by oral dosage form? The common dosage form for the oral administration is tablet, capsule, liquid, solution, suspension and syrup. So what is meant by sublingual route? Sublingual administration is when the drug form is placed under the tongue, rapidly absorbed by the sublingual mucosa. See the slide. This is the way to insert the tablet in between the tongue. So next one will be the sublingual route advantages and disadvantages. There will be some advantages. It will be the economical and with quick termination. First pass will be avoided. Drug absorption will be very quick. So disadvantages will be the unplantable and bitter taste, irritation on the oral mucus. So you're not able to use a large quantity of the drug. Few drugs are not to be absorbed by this method. These are the thing will be the disadvantages by using the sublingual route. So the next one will be the buccal route. What is buccal route? Buccal administration when the drug is formed placed in between the gum and the inner line of the cheek. Now you call this one will be the buccal pouch. You can able to differentiate what is meant by the sublingual and buccal route differential. So you can go through the slide. So where the drug molecules will be placed on the sublingual route, and then the next one will be the subbuccal cavity route. So it will be absorbed by the buccal mucosa. So see the slide. So once the drug molecule will be applied, within applied, what happened? See the color of the drug molecules. After 1 hour, what happened? The color will be changed. After 5 hours, and then what about after 10 hours? The molecule will be completely absorbed. This is the way the thing will be. Drug molecule will be absorbed. Next one will be will be some advantages and disadvantages of this buccal route. What about the advantages? It avoids the first pass of the effect, rapid absorption, and then it will be the drug molecules will be very stability. Disadvantages means will be inconvenience. Advantages lost if it will be swallowed, and small dosage will be limited. You are not able to use a large volume of the drug. Sometimes you may be able to inside the buccal cavity can able to swallow the drug molecules. These are the thing will be the disadvantages by using this way of a buccal cavity route. So what about the next one will be the rectal route. So advantages and disadvantages of the rectal route. So what about the advantages means you can use in children's, little or no first phase effect will be used in the vomiting or unconscious. The patient will be while vomiting and unconscious. You can use the drug molecule via the rectal. Higher concentration will be rapidly achieved. Inconvenient. So sometimes the drug molecule absorption will be slow and then will be irritate. So irritation or the inflammation on the rectal mucosal will be occur. These are the thing will be the advantages and disadvantages while the drug molecules will be used via the rectal route. So next one will be the systematic. So the first one in the systematic, it's a parental. So parental administration, injection or infusion by means of the needle catheter inserted into the body. So term parental come from the Greek word para means it will be the outside. Intra means it's a meaning of the intestine. So it's a root. This root will be the where in this route the drug molecules will bypass the first phase and then will enter into the alimentary canal. So what are the thing will be the system what are the thing injectable? Intravenous, intramuscular, subcutaneous, intraarticular, intraarticular, and then intradermal. So and then inhalation. This is one of the way you can give this sample to the patient. Inhalation means it's an absorption of the drug through the lungs. So what is meant by intravenous? So I'll give some advantages and disadvantages of the intravenous. Go through the diagram. This is a way to, so the drug molecules will be inserted. So there will be the bioavailability will be the 100%. What does mean by bioavailability? Bioavailability means you'll give 100 milligram of the drug. This 100 milligram of the drug, it should be completely absorbed. Once it will be absorbed, it will be excreted via lung, will be the urine sample, will be in the fecal sample. So once the drug molecule completely absorbed, that's why I called it will be 100% availability. So why are the intravenous? So there will be the 100% availability. So desired blood concentration will be achieved. Large quantities. Vomiting and diarrhea. In case of emergency situation, you can use via the intravenous. First pass will be available. Gastric manipulation will be avoided. So there will be some disadvantages in this method. What about the disadvantage? Sometimes it will make a irritation and then it will be repeated injection. Not always will be the feasible. So lesser safe. Technical assistant will be required. Danger will be the injection. Sometimes it will be the painful. So these are the thing will be the advantages and disadvantages while the drug molecule using the intravenous. So the next one will be the intramuscular. So you can go through the slide. So this one will be the intramuscular. There will be some advantages and disadvantages while the more drug molecules using by intramuscular route. So the absorption will be the reasonable and then will be uniform. Rapid onset of the action. Mild irritants can be given. First pass will be completely avoided. Gastric factor can be avoided while you are using the intramuscular. So there will be some disadvantages in this way. Only up to 10 ml of the drug can be used. You cannot use the bulk amount like a 20 ml or 30 ml of the drug via the intramuscular. Only you can use it by this way. You can use an IV. So local and will be pain and sometimes abscess may be occur. Infection can be occur at the side. So it will be leads to this nerve damage also occur. So subcutaneous. What does mean by subcutaneous? Subcutaneous means injection under the skin. So the absorption will be slow action. The action will be prolonged. What does mean by prolonged? Means the sequence will be the continuous. It not to be the 5 minutes or 10 minutes. It will take a 20 to 30 minutes. So the in between the 30 minutes, the drug effect will be prolonged, slow and steady. So the tablet. How far the thing will be do it by this way. So the tablet capsules will be the inserted into the loose tissues by the incision of the skin, which is then stitched up. Example will be the some hormonal capsules or tablets will be do like this. So intraarterial, so it will be rapidly used. So anti-cancer drugs are given by localized effect. Drug will be diagnosis on the peripheral vascular diseases. So you can use for the cancer drug via this method, intraarterial. So the next one will be the intraarticular, injection of the antibodies and corticosteroid hormones administered inflamed joints cavities by the expert. Example would be hydrocortisone in the rheumatoid artery. See the thing. So that there will be some cavity. In the cavity, you can insert the drug. So it will be by only expert people can do it. All of the people are not able to do work this kind of injective way. Root drug administration. So the next one will be the intradermal. The drug is given with the skin layer, dermis. You know the thing. What does it mean? The dermis means within the skin layer. So it will be the painful. So mainly use a sensitivity of the drug. Example like a penicillin, ATS means anti-tetanus serum. So unlike inoculation, administration of the vaccines. So you can via this intradermal, the drug molecules will be treated sensitivity test. While you people will be going to hospital or some other sensitivity drug. So whether some drugs molecules are some drug molecules may be sensitivity to you one. Some of them will be resistant. Via this method, they test the drug for you whether you got any allergy or no allergy for your system. So by this method they'll do it. So the next one will be the topical route of the administration. Topical administration application of the drug directly on the surface of the skin. So the previous one will be the like the oral, and then will be the systematic. In the systematic via the intravenous and intramusculars, and the various ways will be they'll insert. But here the drug molecules will be applied on the surface of the skin. Surface of the skin means on the site where the thing will be the injury will be happen in the skin. So include the administration of the drug on any mucous membrane like eye, nose, ears, lungs, vagina, urethra and colon. These are the things you can use by this way. You can use as a topical drug. Next one. So the forms of the drug. How far the thing will be the forms. While using in the skin, you can use as a cream, ointment, lotion, gel, and then tandem, and then will be the disc. Example for the using the eyes or ears means can use a solution, suspension, and ointment, spray, and powders for using lung. So there will be some advantages and disadvantages on this topical route of the thing. How far means the local therapeutic effect not well absorbed into the deep layer of the skin or the mucous membrane. Low risk of the side effect. Transdermal route of a steadily level of the drug in the system. Spray for the inhalation through the nose, and then it will be good for the activity. So by this way you can use. So there will be some disadvantages and advantages while you people will be using as a topical way of the drug. So the next one has been the transdermal absorption of the drug through the skin, and then it will enter into the systemic action. So the stable blood level, no first phase of the metabolism. Drug must be potent, a patch become too large. So the route of the administration, time until the effect. So I told you the previous slides, various ways of the route of drug administration. So there will be some time duration to stimulate the drug effect. So I'll go for the intravenous. So it will take a 30 to 60 seconds, and then inhalation will be the 2 to 3 minutes. Sublingual will be the 3 to 5 minutes. Intramuscular will be the 10 to 20 minutes. Subcutaneous will be the 15 to 30 minutes. Rectal will be the 5 to 13 minutes. Injection will be the 30 to 90 minutes. Transdermal topical will be variable minutes to hours. It's depend upon the drug molecules, and then it will form of the drug also, whether it may be the ointment or suspension, whatever it may be. That's why they'll put a minutes to hours. So you must know how for the selection of the route. Here the physical character of the drug, speed which the drug molecule will be absorbed and are released. To need the bypass the hepatic metabolism to achieve the site, and then accuracy of the drug, condition of the patient. Based upon the following factors, you must select the route of the drug. In which way you may given to the drug to the patient. Based upon the way you'll got the effect. Thank you. 5 నిమిషాలు